That is true. So Lockport isn't here, but Romaville is. So thank you. We also want to thank McDonald's for serving us breakfast this morning, and we also got donuts. We got both this time.
And decaf coffee.
And decaf coffee. So yeah, but anything you'd like, we're always happy to take in feedback. We want to give you the best experience possible. So with that, we're going to move on. I have a couple friends coming in today. So I know, in the past couple months, I've been chatting with each of you, and sometimes folks have concerns or questions, right? And some of those questions are a little bit beyond me, or they're regarding a different type of form of government. I work over the township, and sometimes I get questions regarding the state. And so I thought this would be a good opportunity to invite, our very own state representative, Representative Dagmara Avalar. She actually represents this district, so I'm going to have her speak for a couple of minutes, and then just out of respect for everyone's time, if you have questions, her office is over on the table here on the side. So if you have questions, we can kind of save them towards the end. But Representative Avalar.
Good morning, everybody. It's a pleasure to see so many familiar faces today. Again, my name is Dagmara Avalar, and I'm the state representative of the 85th District. Now, the 85th District covers 5 different municipalities: Bolingbrook, Romeoville, Lockport, a little bit of Triad, a sprinkle of Naperville, and a little sprinkle of Woodridge. And I say a sprinkle because the majority of the households that I represent are indeed in the Bolingbrook area, followed by Lockport, as well as Romeoville. So you're probably wondering, what is it that a state representative does? Well, a lot of what we do is state legislation. A lot of the work that we do in our office has to do with constituent services. So if you ever have issues with regards to your Medicaid services, not Medicare, because Medicare is federal, but if you do have Medicaid and you encounter problems with the Department of Health and Human Services, we are the office to call. If you do have family members who are actually working with the Department of Regulation and they need their licenses, we are the office to call if you ever need us to troubleshoot that. Things with regards to the Secretary of State. We've actually hosted multiple mobile DMVs to make sure that we are meeting you where you're at, and not the other way around. I have my outreach director here as well, Bree Jackson-Weber, who many of you probably have seen. We do a lot of work in the community. Just this weekend, we are going to be having a back-to-school fair at the Fairmont area, followed by another back-to-school fair in Bolingbrook. So please give us a call if you ever need anything. If you have any questions with regards to legislation, a lot of the work that we do is also explain what's happening in Springfield, which is where I'm usually most of the time from January through May. So thank you so much. I know I wanted to make sure that I made it quick, and it is a pleasure to be here, and we hope to see you soon. Thank you.
Thank you so much, Representative. So I think it's very important that at all levels of government we have very strong relationships with all of our government officials, because it's how we work together that we're able to best deliver results for our residents. So I have another friend here. His name is Christian from ALC Healthcare Services. He's going to talk to you for a couple minutes as well.
Good morning, everyone. How's everyone doing? Happy Tuesday. Again, my name is Christian, and I work with ALC Healthcare Services. This is my partner in crime, Tanya. I'm going to pass the microphone to her for about a minute to also talk to you about our services and support. But before I dive into ALC, just want to thank Alex and Michelle here at the township for greeting us and a nice warm welcome. Thank you to all of you for sharing your time with us. How's breakfast? Good. Can't go wrong with big breakfast from McDonald's. So ALC, that's our fancy acronym that stands for A Loving Company. ALC has been together since 2006, so we're rapidly approaching that 2-decade mark. Our role is to provide home health services and hospice care and support. So from a home health standpoint, we have a team of nurses, physical therapists, occupational therapists, speech therapists, and home health aides that help individuals and their families live more independently and safely in their homes for as long as possible. From a hospice care and support standpoint, a little bit of symmetry there. We have nurses, but we also have clergy, social workers, caregivers, and a one-of-a-kind music therapist that help families and individuals throughout that journey with hospice care. So Tanya will speak a little bit on that. Both of our services are directed by your primary care physician. Doctors write orders, oversee the plan of care, and thus the overwhelming majority of time it's going to be paid for by insurance. The only, I think that caveat there, that sometimes you, depending on your plan, you may have to pay a co-pay or a co-insurance pay. So again, that's our role as healthcare providers. We provide home health and hospice. I'm going to turn the microphone over to Tanya McFarland. She's kind of our guru expert when it comes to hospice.
Hi, good morning, everybody. Thank you again, everybody, for having us. Really quick, by a show of hands, how many people have had somebody that they loved or know on hospice? Now, keep those hands up. How many of those people that have their hands up have had their loved one or somebody that they knew on hospice for more than a week? More than 2 weeks? More than a month? More than 2 months? Excellent. How long? 4 months? Okay. How many people think that the stigmatism that we all know of hospice is obviously end-of-life care? But what happens is people wait too long, right? Hospice, we want to come to you where you are in your home to have the best quality of life for your journey home. Now, does that mean a couple of days with us? Yes, that's typically what happens because people don't like the word of hospice. But how many people have Medicare in this room? How many people know that hospice is covered under 100% under their Medicare benefit? Show of hands. Well, that's pretty good, actually. Now, hospice with that benefit includes all medical equipment. It includes all of your medication. And it includes the entire team, which, as Christian mentioned, music therapy, chaplains, your nursing team, CNAs, things like that. So if I could change your mind just a little bit, I hope I did, and hope I did a little bit of education on hospice, what that looks like, how it is to age in place at home. It doesn't always mean end of life. Cancer diagnosis, a little bit different as we know. Pain management, COPD, CHF, right? Those are diagnoses. Well, you're never really going to, they're not going away, but you can be comfortable and placed at home for as long as you have. So I hope I helped a little bit. Any questions, please don't hesitate to let us know. Thank you guys all so much for coming.
Thank you, everyone. Have a great day. Great rest of your week.
That smells really good, y'all.
So thank you to ALC Health Services. Again, they're good friends. It's important for us to learn information. I do want to give a quick shout out to the Lockport Police Department. They are here in the back. Give them a good round of applause. Again, the police department here in Lockport is so important. It's so great to have them as our friends of the township. And they do such a nice job of organizing this event every month. So it's important to recognize them. But so before I hand it off to our main speaker, I want to again emphasize to everyone that, my office, and I'm Alex Zakian, I'm the Lockport Township Supervisor. My office is located on 1463 Farrell Road, so just kind of, down the street after you go around the corner. So we have some events coming up. They're not quite up for RSVP, but our Senior Breakfast is coming up, and everyone will get their fall newsletter in the next month. So keep an eye out for that. But again, if you have any questions, if you need any help, you know how to reach me, you know how to reach Michelle. Again, our office is located on Fairway. So with that, I will hand it over to our friends over at HI Group from Northeastern Illinois.
Thank you so much for being here. I'm going to be a little further away, but at least you'll be able to hear me. My name is Sam. I am the Aging and Disability Rights Coordinator for Age Guide. A lot of people ask, what is Age Guide? Is it a book that tells me what to do as I get older? And I'm like, no, it's not a book. We're in one of the local area agencies on aging with the Illinois Department on Aging. So we provide funding to social services organizations to provide programs for older adults. We currently cover 8 counties: DuPage, Grundy, Kane, Kankakee, Kendall, Lake, McHenry, and Will as well. We're having a little technical difficulties. There we go. Okay, part of our mission is to help older adults age well. By that, I mean we want to ensure that you have programs that are available to you so that you can stay in your home. So with this, we develop programs that we get funding for through the Older Americans Act. So we are one, like I said, we're one of the local area agencies on aging. We cover 8 counties. In 1965, the Older Americans Act was passed to provide federal funds for core services for mandatory programs for older adults. Anybody is qualified as long as you are at least 60 years old and in need of service. There's no income requirement, so if you have a lot of money or if you're kind of poor like me, you'll still be able to qualify for these services. Part of our key roles as AAAs are to plan, develop, counsel, and deliver services to older adults. So we have home and community-based services programs. A lot of those programs are transportation, caregiver services, legal services as well. So I'm going to go over some of the services that we provide funding for. So some of the core services: caregiver, nutrition, health and wellness, elder rights, supportive services.
Is this garbage?
And we have information and assistance programs. We have counseling programs. We have assistance with Medicare and Medicaid. We have benefits assistance, and we also have programs for outreach. Some of the community-based services and supports that you've probably already heard of or maybe even used are we support programs for the senior center activities. We support education programs as well. We have recreation programs. We have legal assistance. We have programs for transportation and also residential repair. One of the programs that we fund through legal assistance is through Prairie State Legal Services. It is a free service that is provided to you if you need any legal service. You just have to be an older adult. So some of the family caregiver services that we provide funding for are support to the caregiver, respite for caregivers, support for grandparents raising grandchildren. We have different support groups as well that are available to you. We have training and education, and we also have supplemental gap filling for other items that may not be covered under your Medicare as well. So one of our really popular programs is nutrition services. We have the home delivered meals program. For this program, you do have to be an older adult and unable to access like a grocery store, provide food for yourself. If you're interested in that program, I do have information on who you would contact for that program. We also have the Congregate Community Dining Program. Basically, you would meet at a location at a specific time and day, and they would provide meals for you. So one of the reasons why this program was created was not just to provide meals, but also to help with isolation, because it gives you that socialization as well by going to a community dining program. So if you're wanting to know where the community dining programs are located in Will County, I do have information on the table of all the different locations along with the dates and times as well. So another program program is the Elder Rights Services. We are over the Adult Protective Services program. So the Adult Protective Services program is for those who are victims of alleged abuse, exploitation, neglect, or if you know someone that is a victim, they would contact the Adult Protective Services hotline, which is on the screen. And I also have a list of hotline numbers as well that you can take home with you for your convenience. But in order to qualify for this program, you do have to be at least 60 years or older, or 18 through 59 with a disability. Another program that we provide funding for that we're over is the Ombudsman program. The Ombudsman program is for, they have the Nursing Home Ombudsman, which is an advocate for older adults within the nursing home. So if you ever have any issue with the nursing home as far as food or any care that you may be receiving, you could contact your local ombudsman within the nursing home to assist with that. And then there's the home care ombudsman, which provides assistance and is an advocate for the older adult that is in the home and not inside of the nursing home. And also, the Adult Protective Services program only assists you if you are in the home. If you're in the nursing home, you would contact the ombudsman. For legal services, we do have that program that we provide funding for through Prairie State Legal. There's no charge for older adults. They can assist you with issues as far as like adequate housing, any long-term care issues, safety, access to benefits, and other things as well. So some of the other funded programs that we have under the Older Americans Act are the Evidence-Based Healthy Aging Program. We have a program called A Matter of Balance, which is a program that helps you reduce falls and any fall prevention strategies as well. We have a Fit and Strong program. We have a Healthy Ideas program, and we have a Stress Busting program. The Stress Busting program is very popular. It basically helps caregivers be able to deal with the stress that comes with being a caregiver. So we do have resources not only for those that are being cared for, but also the caregiver as well. So another program that we provide funding for is called the Veterans Directed Care Program. This is strictly for veterans. You must be receiving care from the James A. Lovell Health Center and also Hines to qualify for this program. So this program covers in-home caregiving, caregiver support, home maintenance, options counseling, transportation, and adult daycare. Although we do have this program, VA determines the eligibility for this program. So we, with the Older Americans Act, they're really big on how to prevent social isolation. So we do have several programs that we provide funding for to help with this. We have something called a telephone reassurance program. With this program, you are linked to a volunteer that will call you maybe a couple of times a week just to check on you, just to see how you're doing. Because you'll be surprised how many people, especially as you age, they don't have friends anymore that are living. Also, maybe their family isn't as involved, or maybe, their family just doesn't have time to talk to them. So these kind of programs help with that. And we also have the Friendly Visits program, which is available for older adults. Basically, it's kind of like the telephone reassurance program, except you're having face-to-face visits. We will link you up with a volunteer that will come to your house maybe once or twice a week, just to talk to you, to spend time with you. I know we had one lady said that she had her volunteer hanging up curtains. So if you need some curtains hung up, feel free to join the Friendly Visit program. There is also a statewide initiative for Alzheimer's disease and related dementia. Some of the programs we have that we provide funding for are the T-Care program, which is the Tailored Caregiver Assessment and Referral Program. This is really a an evidence-based case management program, basically to identify any interventions for the caregiver and the person that is the recipient to prevent long-term care. There's also the stress busting program that I talked about earlier, which is a 9-week evidence-based caregiver stress intervention program to help if you are caring for someone with Alzheimer's or dementia. And then we also have a program called Tablets for Seniors. Basically, we would provide free tablets to you to promote online connections and also help prevent isolation. So we have several programs for older adults that still want to be involved in the community and work. You can gain work experience in the community through nonprofit or public facilities like schools, hospitals, daycare centers. You will work an average of 20 hours per week, and you're paid at the highest federal, state, and local minimum wage level. You must be at least 55 years old for this program, so it's a little different for the qualifications. You must be unemployed and also have a family income of no more than 125% below the poverty level. We do give preference to veterans for this program, but everyone is qualified for this program as long as they're unemployed and at least 55 years old. So one of the goals, one of the recent initiatives of the Illinois Department on Aging is the need to address fraud and scams. So this isn't a new program, but it's something that we're really trying to get out there. It's called the Senior Medicare Patrol Program. So the purpose of this program is to basically educate on Medicare fraud, so that is a huge thing. There are lots of adults that have lost billions of dollars throughout the country on Medicare fraud. So with this program, we teach you how to protect your Medicare number, to detect fraud, and also what to do if you do see anything fishy on your Medicare summary statement. Okay, so during this portion of the presentation, it's going to be a little different. We're actually going to define healthcare fraud and healthcare errors. We're going to learn how to properly read a Medicare summary notice and what to look for. And we're also going to talk about why it's important to look for these things as well. And then there's a little quiz too. Okay, so what exactly is healthcare fraud? So healthcare fraud is being billed for a service that you did not receive. It's also being billed for something different than what you received, and also being billed for something that was maybe not medically necessary, and also being billed for something twice. All right, so what is a billing error? A billing error is just a human mistake. You know, we're all human. We make mistakes. So it's just a simple mistake, and it's something that you do unintentionally. Something that maybe the provider accidentally entered in wrong. It could be just like one digit off or something. And if it's something like that, it's really easy to rectify that issue with your medical provider. So here's the quiz. I think y'all thought I was playing about the quiz, but there really is a quiz. The definition of blank is when someone intentionally deceives or makes misrepresentations to obtain money or property of any healthcare benefit or program. Is it A, fraud? Does anyone think it's A? A, okay. People say, okay, so does anyone think it's B, an error? Okay, so something with it votes, I guess. Okay, so let's see what the answer is. The answer is A, fraud. It's fraud because it's considered, because the error is considered unintentional and can be easily fixed. So fraud is an intentional act of billing for services that the person did not receive. Okay? So this is a true or false question. Billing errors will always indicate a healthcare provider's or supplier's intent to commit fraud. Is it A? Okay. Who thinks it's B? B. Let's see. The answer is B, FOS, because it's very possible that the error was done by mistake, and because Medicare processes a lot of claims throughout the day, it's very possible that there could be an error. So how much do you think is lost every year to healthcare fraud and abuse? Who thinks it's A? What about B? Okay, a couple people think it's B. What about C? Okay, some people think it's C. Who thinks it's D? Okay, majority of people think it's D. The answer is actually D. That is why we do these presentations and why we have this program, because all of this money is lost each year. And this was actually in 2017 when they had this data. So I'm pretty sure that since it's 2024, that number has significantly increased. Okay, so the overall message of the Senior Medicare Patrol program is to protect, detect, and report. But to protect yourself from fraud, educate yourself on Medicare fraud. Also protect your Medicare card and your Social Security number. Use a calendar or like a personal health care journal to help you track all of the services that you've received. Also, any equipment that you've gotten as well. Also, if you have any suspicion, report it to the Illinois Senior Medicare Patrol. So never give out your Medicare card, your Medicare number, your Social Security number to anyone except your doctor or people you know should have it. Do not accept any medical supplies or services from a door-to-door salesman. Also, do not allow anyone except your doctor or Medicare provider to review your medical records. Okay, so you have a question?
All these people that call, they seem to know I'm on Medicare, and well, give me your number now. I'll check it out.
Okay, so she said there are people that call and they're like, give us your Medicare number. Well, don't give it to them. A lot of times they don't even know if you're on Medicare. They just guess. Because I've gotten calls about my Medicare, and obviously I'm not old enough to even be on Medicare. So that's just a way to trick you into giving your Medicare or Social Security number away. Yeah, that's another clue as well. If they are really blowing up your phone like that, that is definitely a scam. Yes. She was saying that she is an insurance broker, and she said that it is illegal for them to make those cold calls to you and ask for your Medicare number. So she said if anyone ever experiences that, that is definitely fraud. Okay. You could. Yeah, you could.
Right. I'd like to get you consent. They should not call you. They mail you in the mail, but they may not call you.
Right. Thank you for that. So to detect fraud, make sure you read your Medicare summary notice. Does anyone actually read their Medicare summary notice? Only a few people. Okay. So it's very important to read your Medicare summary notice to ensure that they're billing you for charges that you actually should be billed for. You can always request your Medicare summary notice by calling 1-800-MEDICARE, and it's also available online. You should get it, I think, every 3 months? Yeah, once every 3 months it will come in the mail to you. So if you suspect fraud or notice something suspicious on your Medicare summary notice, you can contact the Illinois Senior Medicare Patrol. I do have the number available here for you as well, so that you can take home with you. Okay, so if you think that you may be billed for a service, there may be a service error, please call the billing hotline of that provider. If the provider is acting shady and they don't want to help you, it could potentially not be an error and be fraud, and that's where you would contact the Illinois Senior Medicare Patrol as well. So why is it important to report fraud? We saw how the number was in 2017. There's been $60 billion lost because of this, and of course we know that number has increased as of 2024. So that's why it's important, because billions of tax dollars are lost each year due to Medicare and Medicaid fraud. When equipment is sent fraudulently and not ordered by your doctor, it may harm your health. Also, your Medicare benefit, if you have something on your Medicare summary statement that you didn't get seen for, that is using up your benefit. So when you actually do need that service, they're going to say, well, you already received this service, so we're not going to cover you. So that's why it's very important to look at that to ensure that everything on there is correct, because it can affect you, not just in regards to fraud, but it can prevent you from receiving the care that you actually should be receiving. So next we're going to talk about some examples of healthcare fraud. So here is an example of a phone call scam. A person calls claiming to be from Medicare, stating that you are eligible for free services. The caller states all they need in return is your information, such as your Medicare number. You then give away your Medicare number, but you never receive those services, nor do you hear back from the caller. What is not right in this situation? Everything. That is correct. For one, like the young lady in the back stated, it is illegal for them to call you and ask for this information, and then also you didn't receive the services or the equipment that they called you about. So what should you do in response to this? Report them. Yes, you can contact your Illinois Senior Medicare Patrol. Here is an example of a durable medical equipment fraud. One day, your friend, Mr. Smith, received a call claiming to be from Medicare, asking if he had back pain. The caller asked for Mr. Smith's Medicare number, which he gave the caller. The next week, he received a back brace that his doctor did not prescribe for him, and it did not fit. A month later, on his Medicare summary notice, Mr. Smith saw that Medicare was charged over $1,000 for this. What would you tell your friend, Mr. Smith, he should do in regards to this? Right. He shouldn't be paying anything, but also I heard someone else say that they should report it. For one, no one should be calling you asking you these type of questions, especially about back pain. When you are needing a back brace, you have to be fitted for it, because it has to be specifically for your back. So that's another way to know that this is fraud, besides them asking for your Medicare number. So the last example is an example of a home health care fraud. To justify charging for a home health nurse, a physician who is not the beneficiary's primary doctor falsely certified that the beneficiary is an insulin-dependent diabetic and cannot inject himself. What can we look out for to prevent this, and how can we detect this fraud? So this is a little tricky. For one, you would look on your Medicare summary statement to see if you were charged insulin, because it says that the doctor falsely certified that the beneficiary is insulin dependent. So do you even are you diabetic? That's another thing to look for. If you're not diabetic, of course you're not going to need insulin. And if you have an able body, they're saying that you cannot inject yourself. So these are some of the things that we can look for to detect fraud as well. So if you need any medical services or equipment, make sure they come from your doctor. No door-to-door salesmen. No cold calls as well. Only give your Medicare number to your doctor, and your Medicare will, your doctor will write you an order for whatever it is that you need. So we do have a volunteer program for Senior Medicare Patrol, so if anyone is interested in spreading the Senior Medicare Patrol message, you can contact my colleague Val at this number, or you can contact me. They do train you on Senior Medicare Patrol fraud. We're always looking for volunteers because we always have people wanting this information, but not enough people to actually get it out there. So here are a list of hotline resources. I also have a copy of them on the table as well that you can take home with you. These are very good resources for fraud. If you have any Medicare fraud or just have any questions in general about Medicare or Medicaid. And then these are some of our funded partners through Will County. I also have a list of our funded partners as well. Basically, we have different providers for different programs for whatever you need. So feel free to pick one up off the table so that you can take home with you. Does anyone have any questions? Yes, ma'am.
What I want to know is a lot of times after you go to a doctor, you'll get calls, phone, that you should respond back of how your visit was it good, not good, all that kind of stuff. But then, if I don't respond to that, am I not going to be able to go back to that doctor, or is it just another one? It's not actually a scam, but it's another way of them getting it. Are we responsible to do anything to those? No.
Okay, so she was saying sometimes when she goes to the doctor, she'll get calls basically asking how was your visit. She wants to know, are you required to participate in those calls? Will it affect anything? No, it will not. It's just basically them wanting to know if they did a good job or not. I honestly don't do those either, and I'm still able to see my provider. So if you don't want to, you don't have to. You're not required.
No, that's not a reflection of anything.
Emails, yeah, they send emails that I receive. Yes, ma'am. So that I'm always, so one way you can look at, so she looked at the email, she's just wondering if it's fraud or not. So you can always look at like who it came from to see if it came from Social Security, but you can always log into your Social Security account yourself to verify your anything. That's the best thing to do. Yes, ma'am.
I have a question on a lot of the calls we've been getting lately. The person on the other end of the line says that something along, how are you feeling? Are you keeping up with your diabetic medication? And I'm not diabetic. You know?
Right.
I'm not taking medication. And then they argue with me. I got you right here, and you weren't taking the medication.
Yeah, that's if I actually hang up. I mean, those kind of people, but those type of calls, I would just hang up because especially if they're being really pushy like that. Right. So I don't know if you have AT&T, there's this app called Active Armor, and it blocks all of those calls. Ever since I downloaded that app, I haven't gotten not one spam call at all. So I don't know what they have for other phone providers, but for AT&T, Active Armor app is amazing. Any other questions? Yes,
People have all this I get them from all over the country.
So she was saying she wanted to verify that the $60 billion that's lost in Medicare fraud is the responsibility of those that are on Medicare. Basically because she's saying that you have to look at your Medicare service statement. But a lot of people don't know to do that. Most people get those in the mail and just throw them away. And that's another thing. Don't just throw stuff in the trash. Make sure you shred it as well. Any other questions? Yes, ma'am. Oh, so it's an app. If you have AT&T for, okay, so it's an app called Active Armor, and I can, after the presentation, I can write it down. But you have to download it. Oh, well, landline. I don't know about landline. I'm sorry. I just know about the cell phone. Yeah. Yes, ma'am. So she was saying that she gets Medicare summary notices and she just keeps them and keep piling up. So honestly, once you look at your Medicare summary statement, if you don't see any issues, you can wait till maybe the next Medicare summary statement comes out so that you can compare to make sure that there's still no issues on it. And then at that point, you can shred it. Any other questions? No questions? Okay, well, thank you so much. I hope you all learned a lot today. I appreciate your time.
I think there were issues with AT&T.